A lot of people believe that lung cancer happens for basically one reason: smoking. And yes, smoking is still one of the biggest harms someone can do to their own lungs. But there's a part of this story that almost never gets discussed in depth. There are people who have never smoked and still developed lung cancer. And when that happens, the reaction is usually always the same. The person tries to mentally go back in time, looking for some explanation because they spent their whole life believing they were safe. The problem is that some risks build up silently over decades, without causing pain, without drawing attention, and without giving clear signs at first. And before anything else, it's important to make something very clear, so there's absolutely no doubt. Smoking is still the main risk factor for lung cancer in the world. That hasn't changed. The lungs are made to exchange oxygen with the environment, but when they spend years being exposed to smoke filled with toxic and carcinogenic substances, that delicate tissue starts to suffer small, repeated injuries every day. A lot of people only think about nicotine, but the problem goes way beyond that. Cigarette smoke contains thousands of substances, including compounds capable of causing persistent inflammation and cellular changes over time. And the greater the amount smoked and the longer the exposure, the higher the risk tends to be. Even so, quitting smoking still brings important benefits at any stage of life. Even after many years, the body slowly begins to reduce some of that ongoing inflammation that encourages the development of serious diseases. But there's an important detail that a lot of people have never stopped to think about. If the lungs suffer from repeated exposure to toxic smoke, then you don't have to smoke directly to breathe in harmful substances for years. Many people grew up at home constantly surrounded by smoke. Parents smoking near their kids, husbands smoking inside the car, closed spaces with no ventilation, restaurants, offices, and family gatherings where smoke was just part of the routine. For decades, this was considered normal. The problem is that the lungs can't ignore what they're inhaling every day. Secondhand smoke also exposes the body to irritating and cancer-causing substances. And today, there's another element that mixes in with this silent exposure: air pollution. Sometimes a person has never smoked but has spent 40 or 50 years breathing air filled with particles released by heavy traffic, urban smoke, fuels, and poorly ventilated environments. The most unsettling thing about all this is that no one feels the damage happening in real time. There's no immediate alarm. The lungs keep accumulating tiny microscopic injuries while life goes on as usual. And maybe that's exactly what makes these risks so dangerous. They seem invisible while they're happening. This feeling of silent exposure also shows up in the lives of many people who spent decades working in environments where respiratory protection was practically non-existent. Just talk to someone who worked for many years in construction, mining, workshops, metalworking, agriculture, or factories, and you'll see how breathing in dust, smoke, and chemicals was treated as something normal. A lot of people would leave work with their clothes covered in dust and thought it was normal because everyone lived the same way. But some substances, when inhaled repeatedly, can deeply irritate the lungs over time. Asbestos, silica, diesel fumes, and certain heavy metals are well-known examples of occupational exposures linked to a higher risk of lung problems. And there's no room for blame here. Back then, a lot of people simply didn't get proper guidance or have access to effective protective equipment. Recognizing this past is much more about raising awareness than fueling fear. But before we talk about the other risk factors, which are also really important for you to know, if you want to follow shorter content and everyday tips, follow me on Instagram. Over there, I always share health information with shorter videos. And don't forget to subscribe to the channel here and turn on the notification bell. Here, the content is bigger, it's longer, but I try to bring you the best information possible so you can take better care of yourself. Let's continue. And maybe one of the most uncomfortable factors of all is exactly the one that nobody can see. Not many people have heard about radon, but this natural radioactive gas can accumulate inside some homes and enclosed spaces, depending on the characteristics of the soil, the construction, and the ventilation of the place. The problem is that it has no smell, no color, and doesn't cause any immediate symptoms. A person can live exposed to it for years without having any idea at all. Very closed-up houses, basements, and underground spaces can encourage this buildup in certain regions. And here's an important point. You can't figure this out just by sensing the environment. Radon can only be identified through specific environmental measurement tests carried out with proper detectors. In some countries, these tests are already a routine part of life in areas considered to be at higher risk. Improving your home's ventilation, fixing structural leaks, and reducing the buildup of stagnant air can also help when high levels are detected. And that doesn't mean every house has a hidden danger, okay? The point is to understand that some respiratory risks just aren't noticeable in everyday life. And there's another type of smoke that a lot of people have never linked to a possible lung problem because it usually comes with fond memories. Wood-burning stoves, charcoal, old-fashioned kitchens, spaces heated by combustion. All of these are often remembered with a sense of comfort and familiarity. But the lungs react to inhaled particles no matter if their source seems natural or homemade. When someone spends years cooking or living in enclosed spaces with constant smoke and little ventilation, their lung tissue also suffers from repeated irritation. This has been observed mainly in people who spent decades exposed daily to the burning of wood, charcoal, and other fuels inside closed spaces. Natural doesn't always mean harmless when smoke is being inhaled continuously throughout life. And sometimes the lungs themselves are already carrying the accumulated marks of inflammation over the years. People with chronic bronchitis, chronic obstructive pulmonary disease, pulmonary fibrosis, or significant respiratory after effects often live with persistent irritation in their lung tissue. It's as if those lungs are constantly trying to repair themselves. And along with this chronic inflammation, another factor that deserves attention comes up: family history. Having cases of lung cancer in the family doesn't mean someone will inevitably get the disease. It's important to make that very clear. Genetics is not a sentence, but some people may be born with greater biological vulnerability, especially when environmental factors and accumulated exposures are part of the mix. Perhaps the most dangerous aspect of lung cancer is precisely its ability to hide behind seemingly common symptoms. A persistent cough that someone blames on old smoking habits, a lingering hoarseness that just seems like throat irritation, or shortness of breath that gets worse so slowly it ends up being mistaken for natural aging. A lot of people spend months trying to explain away their body's signals in a way that feels comfortable, because that's what the human mind does all the time. It tries to turn something worrisome into something trivial. In some cases, chest pain appears, in others, there's phlegm with blood. Some people start losing weight for no apparent reason. Others feel a different kind of fatigue, as if their body is running on less energy than before. The problem is that the lungs rarely give a dramatic warning at first. Most of the time, they just hint that something isn't right. And that doesn't mean that any cough is a sign of cancer, okay? This part's really important to keep things balanced and responsible here. Respiratory infections, allergies, bronchitis, reflux, sinusitis, and several other conditions can cause similar symptoms. The point isn't to create paranoia. The point is to understand when a persistent symptom deserves proper investigation. Often, a chest x-ray is the first test that raises suspicion, but a CT scan usually provides much more detailed images of the lungs and can detect smaller or deeper changes. Depending on the specific clinical situation, diagnostic procedures such as a bronchoscopy may be necessary, where a thin, flexible tube equipped with a small camera is used to carefully examine the inside of the airways, as well as performing detailed tissue biopsies and advanced molecular tests that help doctors to fully understand the specific genetic characteristics of the tumor. And even though these tests may scare some people, they exist precisely to distinguish between benign situations and problems that really require quick treatment. Medicine has also changed a lot in recent years. For a long time, many people automatically associated lung cancer with a definitive sentence. Today, the reality is more complex and, in many cases, more hopeful. When the diagnosis happens early, some tumors can be treated with curative surgery. In other situations, options like radiation therapy, chemotherapy, immunotherapy, and targeted therapies come into play. These are treatments developed to act on specific characteristics of certain tumors. Not every patient will need the same approaches. Everything depends on the type of cancer, its location, the stage of the disease, and the person's overall health condition. And although treatment can be difficult in some cases, many people are able to achieve long-term disease control, significant symptom reduction, and a much better quality of life than anyone would have imagined years ago. Maybe one of the hardest questions comes right after the diagnosis. How much time do I have? And the truth is, no one can answer that simply, because every case follows a different path. Some people discover the disease early and are able to receive curative treatment. Others live for years with the disease under control thanks to modern therapies. The type of tumor, how fast it grows, how it responds to treatment, the person's overall health, and even specific genetic characteristics all have a big impact on how things progress. That's why life expectancy can't just be reduced to cold numbers you find on the internet. The human body doesn't work like a calculator, okay? And maybe the most important message from this whole conversation is exactly this. Not smoking is still one of the most important decisions you can make to protect your lungs. But the care doesn't stop there. The environment where a person lives, works, and breathes throughout their life also matters. I'll wrap things up here. God bless you. Take care and a big hug.